Hi, my name is Jenna Patnaik. I'm an epidemiologist at the University of Colorado in the Department of Ophthalmology. I have over 20 years of experience conducting epidemiologic research and analyzing data on a variety of topics in both clinical medicine and public health. My current research focuses on assessing disparities in ophthalmology, with a special interest in disadvantaged populations. In addition to my position as assistant professor, I volunteer for Orbis research efforts. Orbis is a global nonprofit organization whose mission is to fight blindness worldwide. The organization has a strong network of clinical volunteers who dedicate time to vision screening, eye surgeries, and training in lower-income countries. I joined Orbis as their first research volunteer a couple of years ago and would like to share our work on two vision screening efforts. Both of these projects took place in Bangladesh in 2019, prior to the COVID pandemic. Bangladesh is home to the second largest ready-made garment industry in the world, following China. Garment production accounts for over 80% of Bangladesh's total export earnings and employs approximately 4 million workers, over half of whom are women. The nature of tasks involved in the production of garments, such as sewing and cutting, requires close viewing, making good vision very necessary. Over 1,000 female garment workers were offered free screening to assess the prevalence of vision impairment and explore associations with age, income, and residence as urban or rural. 1/4 of the women screened had near vision impairment, with rates increasing by age, and it was higher among rural dwellers compared to urban. A high rate of near vision impairment of 21% was observed among women in their early 30s, which is unusual and much younger than we typically observe. This high rate of near vision impairment may be a result of using near vision excessively for their work. Participants reported a mean monthly income of $93 per month. We found that participants with near vision impairment earned significantly less, with an average earnings of $6 to $9 less each month. Correction of this near vision impairment is often successful and long-term with spectacles. However, only a small percentage of less than 9% of workers own glasses at the time of the survey. Near vision correction could be a strategy for alleviating poverty in this setting and to help address the gender disparities that exist in lower income countries. The second project in Bangladesh assessed visual impairment and risk of road traffic crashes among 700 male bus drivers. Traffic safety is a major public health concern. Road traffic injuries are the leading cause of death globally for young children and adults 5 to 29 years old, and the rates are disproportionately increasing in lower income countries. In Bangladesh, the road crash fatality rate per capita is 3 times higher than that for the South Asia region as a whole. It goes without saying that good vision is an important requirement for safe driving, and visual acuity is one of the key parameters measured when applying for a driver's license. But little is known about vision and crash risk of drivers in the public transportation sector. 2/3 of drivers in our study reported that they had not had their vision tested prior to receiving a license. Nearly 1 in 5 had presenting visual acuity that did not meet the Bangladesh vision standard for bus drivers, and this rate increased with age. A history of 1 or more road traffic crashes were self-reported by 9% of study participants. Drivers with visual impairment were 2.5 times more likely to have a motor vehicle accident, even when adjusting for other factors such as age and weekly miles driven. This study has several important messages for policymakers. To ensure traffic safety, specific vision standards are needed for licensure, and once enacted, need to be enforced by regular testing. Referral for affordable and accessible eye care should be made for all drivers who fail vision screening. Both of these studies demonstrate the importance of good vision and how our vision can impact safety and income at individual and societal levels. In the United States, we often take for granted that we can find options for ophthalmic screening, care, and treatment, but these opportunities are not always readily available in the developing world. Access to eye care services is critical to alleviate vision impairment globally.